Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi everyone, welcome back to this week's episode. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. I'm here to help you find products and procedures that work for you. If that sounds like content that you like, make sure you click subscribe and give this video a thumbs up. On today's episode, we are going to talk about the aesthetic treatments and procedures that are going to give you the most bang for your buck. As an aesthetic medicine provider, it is always my goal to make sure that my patients get the most value when they come to see me in my office. Every single consultation, it's going to be tailored based on your unique personal goals, based on your anatomy, the type of skin that you have, your age, and we always try to keep budget in mind. So something to keep in mind is that aesthetic treatments are not necessarily cheap. They are more of a luxury elective treatment that certain people are deciding that they want to partake in. So when I say budget friendly and when I say things like best bang for your buck, that doesn't necessarily mean cheap. As an aesthetic medicine provider, it's always very important for me to understand where your budget is and keep that in mind, but I don't want to change the medical treatments that I am recommending based on budget alone. It's very important for me to recommend what I recommend based on your unique goals and what I feel is going to get you the most value. So that is what today's episode is going to be all about. I'm going to share my top 6 treatments that I feel like you will get the most bang for your buck with. Most bang for your buck doesn't necessarily mean that this is going to be the right treatment for you. So it's very important that you establish a great relationship with your aesthetic provider so that they can sit down with you and go over treatment options based on your unique aesthetic goals. It's also really important to understand that the amount of bang that you're going to get per treatment is really dependent on the quality of your skin. For example, if you're somebody with really great skin and you're coming in to get a treatment like Skin Vive, you may see a very modest improvement with this treatment. That's because there's not much more improvement that your skin necessarily needs. So results from a treatment like this are going to be very minimal. On the other hand, somebody that has lots of texture issues, lots of fine lines, wrinkles, and doesn't necessarily take care of their skin will get a bigger impact from something like Skin Vive because their skin has more work to do. It's going to benefit more from this procedure. So just because you don't see something immediately, just because you don't see this dramatic result, doesn't mean that the procedure didn't work. It's really dependent on your skin. Another treatment like microneedling, for instance, is going to have the opposite effect. Somebody that has really great skin is probably going to get a better treatment than somebody with lots of texture issues. Those patients are going to need multiple modalities and multiple treatments to see the same type of results. Now that we've gone over all of the basics and important things I think you need to know before digging into this episode, I want to break down my top 6 aesthetic treatments that I feel you are going to get the most bang for your buck. Number 1 is Botox. Botox is number 1 because you get the most immediate outcome. I tell this to my patients all the time. If you have a budget of around $1,000, I would rather you treat full face Botox to get a bigger impact rather than spending your money on one syringe of filler. And that's because you will see a dramatic change. Botox is going to work on the muscle. So typically in about 2 weeks, if you've been frowning and scowling a lot, really exercising that muscle, you're going to see a significant improvement. And when we relax the muscles, you will actually see a dramatic result. For example, let's say you have these orbicularis oculi muscle right here that's super overactive. That's the muscle around your eye. Just treating with Botox is not only going to soften those lines, but it's also going to lift the brow. And that's because it's a depressor muscle. So you're really going to get a big impact when you're treating with Botox. Something else to keep in mind when thinking about Botox and why I think it's such a big value treatment is that there isn't any downtime. It's something that you can go into the office super quick. You can get this procedure in about 30 minutes or less, and you can leave without anybody noticing. So you don't have to take time off of work. You don't have to worry about your friends knowing if you had Botox or not. You don't have to worry about any bruising, swelling, anything like that. Now, It's always possible that you could bruise anytime you put a needle in your face, but if you were to bruise from Botox, it's going to be very small and insignificant in comparison to some of these other procedures. Average dosing for Botox is going to vary. The FDA indication is about 64 units for the upper face. What that means is when the clinical trials were performed, we used about 64 units in order to determine the longevity. That's something that's very important because the more Botox that you get, the longer your results are going to be. So it's very important that you are being dosed properly. On average, people will be dosed anywhere from 20 to 30 units for the frown lines, anywhere from 10 to 20 units in the forehead lines, and anywhere from 10 to 15 units around the eyes, depending on the strength of the muscle. Now, when we add additional areas like for full face Botox and we start to treat the lower face, you will need to plan for additional units. Typically, we will treat the jawline, the platysma bands. Sometimes we'll put a few units in the chin or these muscles called DAO that bring your frown lines down. Adding Botox in these areas can actually provide a lifting effect and you can get a very dramatic difference in your lower face. So I absolutely recommend treating with both upper face and lower face. If you do plan to treat for both, it's going to be around 100 units, which can average around $1,400. Something else to keep in mind is that Botox isn't permanent. So it's something like getting your hair done. If you go to the hairstylist, you get your hair highlighted and you love it, you're going to have to maintain that procedure. So getting Botox, I tell my patients, typically, we will plan to treat you anywhere from 2 to 3 times a year, pending your budget, pending your age, and pending your overall goals. The number 2 most bang for your buck treatment is going to be a CoolPeel laser. Now, I love CoolPeel. If you are not new to this podcast, and you know CoolPeel is one of my favorite lasers. For those of you new here, CoolPeel is a CO2 laser, and CO2 lasers are basically going to take off that first layer of your skin. Why I love this procedure and why I recommend it, and I'm putting it as my number 2 spot on best bang for your buck aesthetic treatments, is because you can treat so many things with this laser. This laser is really great for texture, for pores. It helps with pigment. It helps with fine lines. So really, if you're trying to decide what laser you should budget for, I think CoolPeel laser is going to give you the most bang for your buck. It also has a little bit of a tightening effect, which is super huge for all of my patients. They will see some tightening in their skin even after one treatment. Something to consider with this treatment is there is going to be a little bit of downtime, and really depending on your skin concerns and the overall texture of your skin, we may need to treat you at different settings. So somebody with very minimal sun damage, minimal fine lines, wrinkles, and texture issues is going to be treated on a lower setting than somebody with deeper, more moderate sun damage, more moderate fine lines and wrinkles on their face. They will need more aggressive settings. So depending on which type of setting that we used, you may or may not have more downtime. If we choose a lower setting, you can plan for looking like you had a sunburn anywhere from 3 to 5 days. If you go with a deeper, more aggressive setting, then you're going to need to plan for about 7 to 10 days of downtime. Overall, this laser really treats everything. So I tell my patients, if you are looking for one laser, this is the one for you. Another thing that's super great about the CoolPeel laser is that it's safe for all skin types. It's even safe for patients with melasma, and that is something to really think about. There are certain lasers that people with melasma or darker skin tones cannot use. This is a laser that is safe for everyone. The number 3 treatment that I feel is the most bang for your buck is going to be a chemical peel. Not just any chemical peel. For me, I'm really looking at the more medium chemical peels. One in particular is called the BioRePeel, and I love this because it is a medium depth 35% TCA peel. So with this peel, you're going to get dramatic impact. It's also going to treat multiple concerns. You can plan for getting this treatment if you have issues with acne, if you have issues with texture, scarring, hyperpigmentation. And my favorite thing about this procedure is that there is minimal downtime. You're not going to have to plan for lots of peeling and snake shedding of the skin. I don't know about you guys, but for me, the downtime of a chemical peel is something that I just don't tolerate. So coming in for a procedure like BioRePeel is something that I could plan for to get a really great outcome with very minimal downtime. And I know it's going to treat multiple concerns. These types of peels are super quick, can be added onto any procedure. In my office, I add them on to Diamond Glow facials. We add them on to Botox. We also treat just by itself. So it's something that you can come in for and you will get a really good result even after one peel. Next on my list, and this is probably my favorite, you guys, is going to be chin filler. Why chin filler? Well, chin filler changes lives. I tell this to my patients all of the time. The value of having an enhanced profile is insane. I'm not joking. It's the one thing that I tell my patients. If you pick anywhere to treat on your face, you need chin filler. Now, not everyone is a candidate for chin filler, but I would say about 90% of people are. A well-defined chin can really harmonize your features, and right now something that's really trending is not treating single areas, but overall balance in the face. And I feel like when you treat the chin, you can harmonize so many features and really balance the face. Now, chin filler also has very minimal downtime, which is really great. You do need to plan for some bruising and swelling, but it's a non-surgical option. So it's something that I recommend for my patients all of the time. It's also dissolvable. So let's say worst case, you hate this procedure, which I'm telling you guys, everybody loves a chin. If you do, it can be dissolved. Fillers are hyaluronic acid based, so they are made of something that is naturally made in our body. They're just made into a gel-like form so that they can provide structure to your face. So let's say you don't like it, there is a dissolving option called hyaluronidase that will actually break this filler down. So it's something that's non-surgical, it's not permanent, and it does make a dramatic impact. So in order to determine if you are a candidate for chin filler, you need to make a consultation with a trained aesthetic provider. However, if you are looking into the mirror, I recommend that you turn your face to the side and you take a picture. It's really easy to be able to tell features via photo rather than just looking at ourselves in the mirror because we see ourselves two-dimensionally. And something that happens with time is we actually lose fat in the lower face and our bone starts to shift backwards. So our profile maybe used to be sharper and more defined, and as we age, it's going to shift backwards, resulting in a less defined profile. Having a more defined profile is going to make you more attractive. It's going to make you look better in photos and improve your overall profile. If you snap this photo and you see that your chin sits behind your lower lip significantly, you may be a candidate for chin filler. Ideally, we bring the chin to where the bottom lip is or slightly more forward, pending your ethnicity and your overall facial features. But I love taking a good profile picture to determine if my patients are a good candidate for this procedure. If you decide that you are a candidate for chin filler, then you can plan from anywhere to 1 to 2 syringes per treatment, and this treatment will last around 1 year. Some people get a little bit longer, some people get a little bit less. It really just depends on your metabolism and also the strength of the muscles in the lower face. People that have really strong active muscles may notice that their filler dissolves faster than people that don't. Number 5, most bang for your buck procedure is going to be Sculptra. And I love Sculptra. Sculptra is a biostimulator. What that means is it's going to force your body to stimulate its own natural collagen. As we age, our body goes on a collagen decline. What that means is we don't produce more collagen and we actually start to lose collagen. Collagen is this protein in our body that makes our skin firm, bouncy, tight, and elastic. So as we go on this decline, you'll notice that you have some changes in the texture of your skin, that your skin starts to appear more saggy, less firm, and less lifted. Sculptra is my number 5 procedure because you will get so many benefits. Not only do you get a really great skin glow from this procedure, but you will notice that you can get some volume enhancement, you will get some lifting of the skin, and the improvement of your overall features will just look amazing. So I tell my patients, if you're planning on getting one aesthetic injectable treatment, you don't really know what to get, I always recommend Sculptra. It is corrective, it is preventative, and you can really treat the entire face with it. So it's something that you're gonna notice maybe not as dramatic of a difference as you will with chin filler or any types of filler, but you're gonna notice more benefits using Sculptra than you would with just treating one area with filler. So really just depending on your goals and your budget, you may want to consider Sculptra if you want to get the most impact and long-term results. Sculptra will last up to 2 years, which is really cool. I typically tell my patients that you have to treat every year if you want to be preventative, and that's because we lose collagen every single year. So plan to do one Sculptra treatment per year if you want to maintain outcomes and be both preventative and corrective. Something to keep in mind with this procedure is that you may need multiple sessions. That's really the downside of Sculptra. I love the impact that it provides, so I had to put it on this list because you get so many benefits with collagen, elasticity, and just the overall improvement of your skin and volume loss. However, if you are, let's say, over the age of 30, maybe you're in your 40s, or you have significant amount of volume loss due to weight loss, due to age, due to any really combination of factors, you may need multiple sessions. So it's really important that you establish a relationship with your aesthetic provider so you guys can go over what your overall goals for and really what's going to be the best investment for you. Now, number 6 on my list, I saved for last because it's a surgical option. And in my world, I will always tell my patients surgery is number 1. It's going to give you the best possible outcome. Now, not everybody needs surgery. Not everybody can afford surgery. Not everybody wants surgery. It's just something that if you are getting injectables and your provider hasn't mentioned, that's a red flag. They need to tell you absolutely everything that you are a candidate for, and you need to understand realistic expectations with surgical versus non-surgical outcomes. For me, I always recommend a blepharoplasty. If you have sagging skin around the eye, you need a blepharoplasty. What that means is they are going to literally cut the skin off around the eye and give you an eye lift. This will significantly improve all of your face. You will not get heavy when you get Botox. Having heavy lids not only makes you appear older, but it also makes it harder to inject your forehead with Botox because Botox will relax the muscle that lifts your brows. So if you already have heavy lids and you want to get Botox, I always recommend getting a blepharoplasty first. Now, I put it on this list not because it's cheap, but because I feel it is the most cost-effective cosmetic surgical procedure that you can get. It's about $5,000 plus or minus, but you get a significant impact with this, you guys. It changes your whole face. You can get Botox in your forehead. You look 10 years younger, and it's something that is relatively pretty quick with minimal downtime in comparison to something like a deep plane facelift. I really think this is such an amazing procedure, especially as we age, because we lose fat around the eye. We experience skin laxity. Our skin starts to stretch with time and mechanical trauma. I did an entire podcast about the eye. So if you want to listen to that, make sure you click this link. It has every single treatment from non-surgical to surgical to even products at home that I recommend for treating around the eye. And blepharoplasty is the surgical option that is on there. You can treat not only your upper lids, but your lower lids. So if you are somebody that has heavy or sagging lids, definitely check out that episode and consider getting a blepharoplasty. I hope you guys enjoyed today's episode. My goal was to provide you with a list of aesthetic treatments and procedures that really give you the most bang for your buck so that you can decide what you want to spend your money on. It is an investment. I tell my patients this all the time. So it's really important that you establish a really good relationship with your provider so that you can determine the best planned investment for your skin. Like and follow for more. I will see you guys next week.